Are we heading for another COVID crisis? Is the NHS in England about to buckle? The body that represents NHS managers certainly says so.
Services are under immense pressure through this combination of three things. The winter pressures the NHS always suffers, COVID, and unfortunately cases are rising and they're going to continue to rise, and the backlog that's built up over the last 18 months. You put all that together and it is a kind of perfect storm.
NHS leaders are calling for the government to bring in urgently lockdown restrictions. Plan B is the name the government gave to their alternative strategy in a paper published in mid-September. It would include telling the public to be more cautious, only allowing vaccinated people in certain settings, and legally mandating face coverings in some places. The government would also consider asking people, if they can, to work from home again. For some businesses, there's a concern that this Plan B is just too vague to be useful and doesn't include government-funded workplace testing that could help some companies stay open in what is already a very difficult time.
This winter looks increasingly tough. You've got the supply chain problems, you've got the energy crisis, you had fuel before, and you've got tax rises coming as well. So small businesses' confidence is beginning to go. So that makes Plan B actually quite difficult, and any further restrictions much tougher on top of that.
According to data from the NHS, the number of patients admitted to hospital has been going up and up over the past 6 months. But if we zoom out to cover the whole of the pandemic, it's clear that hospitalisations are nowhere near where they were in the first and second peaks. And the same is true for deaths. Over 6 months, we can see that sharp rise that's worrying health professionals. But again, over the course of the pandemic, we are not close to the levels reached in previous peaks. Where we do seem to be on a similar path, though, is on cases, those testing positive for the virus.
We're looking closely at the data, and we won't be implementing our Plan B of contingency measures at this point.
At a Downing Street press conference this afternoon, the Health Secretary, Sajid Javid, pushed back against the idea that the health service is at breaking point.
We don't believe that the pressures that are currently faced by the NHS are unsustainable. Don't get me wrong, there are huge pressures, especially in A&E, in primary care, for example, as well. But at this point, we don't believe they're unsustainable. If we feel at any point it's becoming unsustainable, then the department, together with our friends at the NHS, we won't hesitate to act.
The Health Secretary conceded that the UK case rate could easily hit 100,000 a day. That's more than double what it is now. And if that happens, well, NHS managers say it could be too late to stop the health service being overwhelmed.
What we've seen today from the Secretary of State is a recognition that things are going to get worse, and from the Chief Medical Officer, but still a kind of resistance to doing the things that would probably make things a little bit easier ahead. And I'm glad the government is monitoring the situation. I'm glad they haven't closed their mind. But what worries me slightly is the kind of sense that somehow the government sees it as almost a defeat to admit that they need to move into a different gear, that they need to reintroduce some measures of control. And it's not a defeat. It's a pragmatic and reasonable response to the circumstances that we find ourselves in.
But some businesses want the government to delay more restrictions for as long as possible.
We know that decisions will need to be made on Plan B and then later on any further restrictions. And that key point there is, if you're going to do either of these two, you've got to support small businesses and look at how to keep them going through another difficult winter.
The government is clearly hoping that simply by holding out the prospect of more restrictions, it will get the public to take more precautions, which could mean that those government mandates aren't ultimately necessary. However, if that doesn't work, well, it might be too late for Plan B.
David Grossman there. Well, joining us now is the government's former Chief Scientific Advisor, Professor Sir Mark Walport, and the Conservative MP, Dr Andrew Morrison. And a warm welcome to you both. And what we've heard from Sajid Javid clearly is just concerning the rules as things stand in England today. But if I asked you about those figures, Sir Mark, 200 deaths a day and the threat of 100,000 cases, in other words, double what we are now by winter, is that a normal trajectory for you, or is that a...
Well, there is no such thing as a normal trajectory.
Are you worried?
But am I worried? Yes. I mean, I think it is very, very delicately poised. We have a lot of cases at the moment, and certainly in England, the numbers are going in the wrong direction. So the latest ONS figures showed that the prevalence in the population was over 1%. We've got about 800 people on ventilators. We've got almost 1,000 people going into hospital a day. Winter is coming. Flu is probably coming. It's not a good place to be. And so the evidence is that the current measures are probably not holding things at the moment. That's the issue.
Would you be going further? I mean, you've heard what the BMA said today. They called it willful negligence not to take direct action, to start doing more now.
Well, I mean, the real priority at the moment is vaccination. That's the issue, and we've got to really get on with the booster program, I think. So what we're seeing is that there have been about 4 million people who've had the booster so far, but if you look at that population, there were probably 8 million people roughly who've already had the vaccine more than 6 months ago. So it's not going at the same rate.
Well, why is that, Dr. Morrison? What we did so well on that early rollout of the vaccine, and the booster is it pick-up or is it rollout, or have we lost all the volunteers because people are now back at work? What do you think it is?
Well, the vaccine programme in this country has been a huge success, Emily, hasn't it? I think that's recognised. We were early into this. It follows, of course, that we need to be very quick off the blocks in terms of the booster, because some of the efficacy may now be running a little bit thin. So it is absolutely vital.
But that's what I'm asking.
This programme now really takes off.
We've heard that from Mark Walport, that we need to get everyone boosted, as it were. But what's going wrong there now?
Well, I don't think it's a question of going wrong. As Sajid Javid said earlier, the vaccines are there, the people are there to do the vaccination, but they just need to get the arms in which to put the vaccine. And I agree entirely with Sir Mark about flu, and I think this is a real danger. As recently as 6 years ago, we lost 28,000 people in bad winter to seasonal flu, and we must make sure that people are vaccinated against flu.
Are you more worried about flu now than COVID?
Well, I think it's difficult to say, but I think past history suggests that flu is a clear and present danger, and particularly in the context of last winter, where flu was simply nowhere, it's more than likely it's going to come back and bite us this time.
We learned, didn't we, last time round, that the best way to flatten the curve is, I think Patrick Vallance repeated it last week, you go ahead, you go earlier, you go harder, you go broader than you perhaps want to at the time. You're looking ahead of where you're firing, in other words. Why are we still not quite there this time round then? I mean, I suppose the answer is the
answer is that, of course, there are new variant viruses as well. So, I mean, the Delta virus, which is very much more transmissible than the earlier variants, makes it much harder. And so to actually get herd immunity, population immunity through vaccination requires a very high percentage of the population to be vaccinated. And we also have been an outlier in terms of vaccinating younger people as well. And so I think that's an issue. So, but I mean, vaccination has got to be the way out, because otherwise the infection will just continue to be rampant.
So you wouldn't be looking at mandatory mask wearing now? You wouldn't?
Well, look, there's no single factor. And certainly if you compare us with our European counterparts, there's much more mask wearing. And I mean, the issue is that the guidance says wear masks, but the reality is it's not happening. And so the guidance isn't working.
Sajid Javid was asked about leadership on that one today from our colleague Sebastian Payne. As a medic and an MP, do you feel it's incumbent upon you all now to lead the way with mask wearing? Would that be a step that you all think you should make?
Well, I certainly believe in leadership, but what I would say is we need to be very careful about suggesting that a particular non-pharmaceutical intervention is going to be the key to this. It isn't. What's key to this is making sure that we're vaccinated. Overwhelmingly, that's what we can do to protect ourselves and other people.
So we won't see masks in the Commons with the MPs?
I think it depends on how the situation evolves. Mask wearing is just one intervention that could possibly be considered, but I think Sajid Javid is right, we're not there yet.
But these are sort of not either-ors with respect. I mean, I think that we need to do everything we possibly can. And it is very delicately poised, because what we're seeing is we've been seeing numbers over the past couple of months sort of hovering around somewhere between 35 and now heading for 50,000. And so, the combination of relatively small measures may have a significant effect. We just need to increase the effective social distancing a bit, and it will probably start getting us in the right direction.
There was an interesting point raised in that piece of David's earlier, which was this sense that perhaps the government or even the party feels that any as it were, concession, as a defeat, instead of saying this is just a pragmatic response to what we have to do now. Nobody wants to see more people get ill. Nobody wants to see more people die. It shouldn't always be seen in terms of a victory or a defeat, and we have to get over that mindset.
Yeah, I don't think there's that mindset in government. I really don't. The winter plan was very clear. There's a plan A and a plan B and a gradated response somewhere in between. I think what's happening is ministers are keeping a very close eye on what's going on and the figures and the data, looking at what's happening overseas, and for example in the Netherlands and Sweden wear masks even less than we do. As it happens, it's not the case that all European countries are keener on wearing masks than we are, and will make a pragmatic decision on a daily basis, and I think it's going to change quite rapidly.
But I mean, one thing I think that we do agree on is the importance of boosters, and the evidence that's come out of Israel, where they started actually giving them 5 months after the second dose, is that it more than tenfold reduces severe infection. I mean, the consequence of severe infection. So we know that boosters work, and that's going to be really important.
Are you short of volunteers this year? I mean, you said it was just about getting the arms to boost. Yeah. Have you got all the staff that you need? Because I know that last time around, a lot of people, a lot of us were sort of, putting our names forward and yes, offering to be part of the volunteer project. Yep. And of course, if people are back at work, if furlough's ended, you haven't got the yep, staff, have you? You haven't got the power.
Well, I have to say one of the extraordinary things about this whole episode is the extent of volunteering in this country. I've volunteered myself, and I was just overwhelmed with the public response to this. You're quite right. Now we're back at work. I suspect that pool has reduced somewhat, but my belief is, and Sajid Javid touched upon this earlier on, that we are able to put jabs in arms. We're just short of the arms, so we must have people come forward, have their booster when they're called, chase it up if they're not called, and of course not forget seasonal flu.
I mean, there is a sense of, clearly, of déjà vu about this, when I think at some point we thought that the vaccine itself was going to be that silver bullet. That, I mean, we're not dying at the rate that we were this time last year.
No, that's quite true. I mean, the vaccines have been amazingly successful, actually. I mean, they have been much more successful than I think anyone dreamt of in terms of their effect on severe disease. So, we are seeing a fraction of the deaths that we were seeing before. I mean, every death is a tragedy, and it's about 136 a day. So it's certainly not, a very small number, and a significant number of people on ventilators. And, some of them will die, but some of them will also remain quite sick for a long time afterwards.
Thank you both very much. Thanks for coming in.